talking about non-Hodgkin lymphoma. Non-Hodgkin lymphoma is anything which is outside of the Reed-Sternberg cells. Hodgkin lymphoma is a lymphoma, so a cancer of the lymphocytes, with a characteristic Reed-Sternberg cell appearance. Non-Hodgkin lymphoma is anything which does not have that typical Reed-Sternberg cell appearance. What types of cells may be affected in non-Hodgkin lymphoma? So a B cell and a T cell may be affected in non-Hodgkin lymphoma. Non-Hodgkin lymphoma is more associated with males, and one of the most common types is Burkitt lymphoma. So, of the non-Hodgkin lymphoma being either a B cell or a T cell cancer, which one is Burkitt's lymphoma affecting? It's affecting the B cells. It's due to what translocation? It's due to a chromosome 8 and chromosome 14 translocation. Burkitt's lymphoma is associated with which virus? It's associated with EBV virus, which is causing infectious mononucleosis and glandular fever. Which form out of the 3 forms of Burkitt lymphoma is associated with EBV? The answer here is sporadic. The sporadic form of Burkitt's lymphoma is associated with Epstein-Barr virus, which begs the question, what are the 3 types of Burkitt's lymphoma? You can get a sporadic form, which is more common in US and Western countries. That's the first. Secondly, you can get an endemic form. The endemic form is the one which is common in Africa and sub-Saharan Africa. And third, you can get an immunosuppressive form of Burkitt's lymphoma, and immunosuppression can be to do with HIV. Non-Hodgkin lymphoma as a whole has a number of associations which I'll tell you about now. There's 3 H's and an E. 1, it's associated with Helicobacter pylori maltoma, MALT. 2, it's associated with hepatitis C virus diffuse B-cell lymphoma. Then it's associated with Epstein-Barr virus with Burkitt's lymphoma, and a human T-cell lymphocytic virus, which is for the T-cell one, T-cell lymphoma. Now going into Burkitt's lymphoma in detail, so I told you that there were 3 forms of Burkitt's lymphoma and it was affecting the B-cell cancer. The 3 forms were the sporadic, the endemic, and the immunosuppressive type. What were the 4 M's that I came up with for Burkitt's lymphoma? M was for malaria, M was for more in kids, M was for males, and M was for mandible, because Burkitt's lymphoma often presents with a lower mandible swelling. Is Burkitt's considered a high-grade NHL non-Hodgkin lymphoma or a low-grade non-Hodgkin lymphoma? Burkitt's is considered a high-grade non-Hodgkin lymphoma because it is the fastest growing tumour, in fact. So it's a high-grade non-Hodgkin lymphoma. Now, one interesting fact is or is not Burkitt's lymphoma chemotherapy sensitive? Does it respond? Does it have a survival rate? Yes, Burkitt's lymphoma is very chemotherapy sensitive, and it does have a good survival rate of more than 90%. Now we've covered the important parts of Burkitt's lymphoma, I want to go back to non-Hodgkin lymphoma. So how is non-Hodgkin lymphoma different to Hodgkin lymphoma? Non-Hodgkin lymphoma typically does present with painless lymphadenopathy, but it's more likely symmetrical on both sides. And it's always extranodal. Think of, you know how Hodgkin lymphoma as HL, just 2 letters? Non-Hodgkin lymphoma is NHL with 3 letters. So think of it as extranodal. Always extranodal. And like I said, that there are 2 types, high-grade NHL and low-grade NHL. You're going to get B symptoms here again. What are the B symptoms that are typical for lymphoma, both Hodgkin and non-Hodgkin? The B symptoms are 3: fever, night sweats, and weight loss. True or false? Extranodal disease, like skin lesions or neurological issues, is more common in non-Hodgkin lymphoma. This is true. Okay. Finally, investigations and treatment for non-Hodgkin lymphoma. Your gold standard is a lymph node biopsy. Is your gold standard investigation for non-Hodgkin lymphoma. And the other things you can do is obtain baseline bloods and a peripheral blood smear. Okay, true or false? LDH is a prognostic marker for poor prognosis. It's true. LDH, both in Hodgkin's and non-Hodgkin's lymphoma, is a poor prognostic marker. It's a very severe disease marker. Is non-Hodgkin lymphoma associated with superior vena cava syndrome? And if so, what is the sign we're looking for? Yes, NHL, which has a 3-letter abbreviation, is associated with another 3-letter abbreviation, which is SVC. So superior vena cava obstruction is common, and these patients will present with something called the Pemberton sign, which is positive. Pemberton sign is when asking these patients to raise their arms up, they'll get facial plethora, which is redness and a deep flushing of the face because of the jugular venous pressure, because of the non-Hodgkin lymphoma tumor causing compression on the superior vena cava. True or false? A viral or a bacterial infection is commonly associated with non-Hodgkin lymphoma. This is once again true. We talked about viral like EBV. Okay, what is the treatment for superior vena cava obstruction? Dexamethasone. Okay, so investigations was a full blood count and a peripheral blood smear, but the lymph node biopsy was gold standard. What other investigation can you do to stage? You want to carry out a PET CT, okay, and you'll stage it with Ann Arbor classification, which I'll talk about in the next one. And you can also do a bone marrow biopsy to check bone marrow involvement. Treatment. We've already talked about how it's very chemotherapy sensitive. So you have low-grade non-Hodgkin lymphoma and high-grade non-Hodgkin lymphoma. In asymptomatic patients, just wait. Otherwise, go for a chemotherapy regimen, which has lots of different options, which is CHOP. You can use rituximab, which is recommended for B-cell lymphoma. Rituximab is actually a monoclonal antibody. How does it work? Rituximab is a monoclonal antibody which targets the protein found on the B-cell membrane and eliminates B cells. And as it eliminates B cells, it promotes the new production of new healthy B-cell colonies, which is why it's useful in B-cell lymphomas. What is a complication of using these chemotherapy agents in non-Hodgkin lymphoma? Let's say a patient presents to you with severe abdominal pain suddenly, and they have fever, they have abdominal pain, they have malaise, and they have reduced urine output. What complication is this? This is tumor lysis syndrome, which is a sudden, rapid destruction of tumor cells in tumor lysis syndrome. leading to these symptoms and leading to cup electrolyte abnormalities. What is the cup electrolyte abnormality mnemonic? Well, C is for calcium, which would be low, U is for urate, and P is for potassium. Don't forget, tumor lysis syndrome is associated with the cup abnormalities in the electrolytes. Well, the potassium might be high, so what are we on the lookout for? Arrhythmia, so we'll do an ECG. This is everything for non-Hodgkin lymphoma, and I'll come back to discuss clinical vignettes. Thank you.